You call it pain in your pelvis, pain in your hip, pain in the butt. The reality is pain in the sacroiliac joint. That's the subject of this video, so stay tuned. Hey, this is Dr. Shaki from Irvine Spine and Wellness Center, your Irvine Posture, Movement, and Chiropractic Clinic. I wanted to talk to you today about sacroiliac joint. This spine is badly abused, super loose. You don't want to have a spine like this. But I wanted to show you this. So this is the front, that's the back. Sacroiliac stands for sacrum and ilium. So that's an SI joint, sacroiliac joint, and you've got two of them. So the integrity and the positioning of your sacrum in relation to the ilium is huge. It plays a huge role. And imagine this is the sacrum, and that's your ilium. This is how this poor thing's fallen apart. So imagine the two of these, this joint here. Is this pretty clear? Mm-hmm. So if it's moving, if the sacrum is moving up, your ilium's going forward. So extension, flexion, opposite of each other on each side. You can have sacroiliac joint pain in your butt. It's not a hip. Hip is here where the leg is connected to the pelvis. But people, when they come here and they say, I have pain in my hip, and I say, show me, they refer to the SI joint. Pain in the butt, because that is the butt. That's right over here. This is where your SI joint is, sacroiliac joint. So what ends up happening is at the junction of the sacrum with your ilium, there are a lot of muscles and ligaments that are keeping them together. The relationship of the two is maintained with them. And when those tissues are either, I call it sticky, when you're not really getting proper movement in the area because you're not walking so much and your lower extremities are not performing, it's like a huge series of events that are taking place. But when you are not having proper alignment, proper synchronicity of movement between the sacrum and ilium and structures above and below, and a lot of other factors that impact how this joint behaves, then you will end up with sacroiliac joint pain. So the fix is not necessarily just an adjustment. Adjustment's great and it does fabulous things, but that's not sufficient. If you isolate the area and try to work your glutes or your hamstrings, that is not going to solve the problem either. There are a series of exercises that have to take place, and specifically the ones that require stabilization of your torso, your trunk, stabilization of the joint on both sides in movement. If you are too rigid in the joint, then the joint's not going to give when it needs to give. If you're too loose within the joint, then it's too loose and it's not stable enough. So we need to bring the whole body into the exercises that involve this specific area, so this specific area can actually be rehabilitated while the rest of your body is performing its own job. We're going to do a video of exercises that I find to be very helpful with my patients, and we'll make sure we put it in the back at the end of this video. If you have any questions, if you have any pain that in that area or malfunction in the area that you are having a hard time finding a solution for, make sure you contact one of the methods of contact in the description box. And while you're at it, make sure you subscribe and turn on the notification. And until next time, take care.